Assalamu alaikum and good morning. My name is Jamila and I will be moderating a really exciting session today around health diplomacy. So thank you to IDFR, Wisma Putra, for asking me to do this. And it's with great pleasure that I have some very, very important guests who will join me. Just as a background, I'm a health professional. I've worked globally in health diplomacy, both at the UN and International Federation of Red Cross and Red Crescent Societies. I am also a humanitarian and also someone who works a lot in emergencies, especially health emergencies. My current role is as the Executive Director of the brand new Sunway Center for Planetary Health, based at Sunway University in Selangor. So with me today, physically, is first of all, welcome Yang Berhormat Dr. Kelvin Yee, who is a Member of Parliament for Bandar Kuching and who currently chairs the Parliamentary Special Select Committee on Health, Science and Innovation. And before this, he sat on the Parliamentary Budget Select Committee. Dr. Kelvin Yee has a very interesting background. He's not just a doctor, but he's also a lawyer. He has a Bachelor of Law from London, and also a master's later on in Northumbria University. That was also my alma mater, Newcastle upon Tyne. So he was also the director of the Malaysian Medical Fellowship, a non-profit that connects medical students, healthcare professionals and volunteers for good and positive influence. So, like me, he's also a humanitarian. So, we're really happy to have you here, Dr. Kelvin Yee. Physically with me as well this morning, I'm very happy to introduce and welcome Dr. Lo Ying Ru, or Jacqueline. I will refer to you as Jacqueline in this conversation if you don't mind. And she is the WHO representative to Malaysia, Brunei, and Singapore. So she's been in this role since 2017, and in her position, she leads strategic and policy dialogues with ministries of health and ministers and their partners as well. So she is an infectious disease physician from Hamburg in Germany with more than 30 years experience as a clinician and public health advisor. And she's been with WHO since 1998. And her CV is very, very illustrious. But more importantly, Dr. Lo has been very instrumental in also being a great friend and partner to our government in our COVID response. So thank you very much for being here. Last but not least, we have someone virtually, and of course, we have the Chief Executive Officer of our Malaysia Healthcare Travel Council, Cik Muhammad Daud Muhammad Arif. Welcome, Muhammad Daud. As you can see, he has a nice pink band on his wrist, which means either he has been traveling or unfortunately positive for COVID, but I'm told that he has been traveling, so we're happy that you're well and safe at home. You are just recently appointed, and congratulations for that, in 2021 in April as the new CEO, and he has a rich experience working on tourism policy and international affairs at our Ministry of Tourism, Arts and Culture in Malaysia, and the lead shepherd for the APEC Tourism Working Group. And with more than 20 years of leadership in this arena, he now brings a fresh perspective to Malaysia's healthcare growth and really furthering our vision to be a leading global healthcare destination. So welcome to this chat, Muhammad Daud. So for the purposes of this conversation, we want to keep it really conversational and really, candid and hard-hitting. And because one of the things I didn't mention is I am fortunately a member of the Consultative Council for Foreign Policy at the Wisma Putra. And health diplomacy has come up as a really important component of diplomacy, and even more so now with the pandemic that we are navigating. So if I can start with you, Dr. Lo, what is health diplomacy really, and is it really important today?
Tan Sri, yes indeed, health diplomacy is very, very important for us, for WHO, and for the people in the countries, including in Malaysia. So health diplomacy is a discipline which brings together public health, law, and foreign policy. So It's a political activity which brings or which aims at goals like improving health, but also improving international relations. And can I give some examples? So it's actually a very old concept, and I just wanted to go back in history. Like in 1836, the Sultan of Constantinople, he declared a quarantine across the Ottoman Empire, and that was the first time that was to contain plague. And it was not very well received, but it was something where states had to negotiate and to derive at consensus to contain a public health problem. And similar to that, maybe a more recent example is about health diplomacy focusing on vaccines, and there we talk about vaccine diplomacy, and that's about 60 years ago when Sabin, a scientist from the US, discovered 3 strains of polioviruses, and it was actually brought forward by scientists from Russia, and they worked together to develop the polio vaccines. And this collaboration ultimately resulted in the Global Polio Eradication Initiative. So here we have really very, very strong examples. And if we look at the relevance today, we have outbreaks, we have HIV, we had SARS, we have avian influenza, Ebola, and now COVID-19. These are all global health problems which not one nation alone can tackle, and this is where diplomats, the foreign policies are so essential. They go beyond national security, but you maintain your national security through negotiations with other countries to join your efforts to contain a disease outbreak, for example. So maybe that's just very important to start.
Yeah, maybe I want to build on that a little bit, because I think, just to say that I'm happy that you gave the example of I think it was Sultan Mehmed in Turkey, maybe him during that Seljuk sort of that empire, the Ottoman Empire, right? But because many people don't realize that the roots of our diplomacy, politics, policies are actually very, very old. But coming back to what you said about protecting people, right? Do you think that there has been enough done at the regional and global level to look at, for example, vaccine equity?
Probably both of you know very well that there have been so many global efforts to improve vaccine equity, and the very instruments which have been created by the United Nations, which has really embraced health diplomacy and vaccine diplomacy, where diplomats help us actually to negotiate vaccine or health improvement of health and also vaccine equity. We have created this mechanism, this platform, which is called ACT Accelerator, the Access to COVID-19 Tools Accelerator, which includes vaccines, access to or development or promoting the development and access to vaccines, but also test and treatment. I think it was an effort, and particularly important in the context of shortages of vaccines, because in the beginning there were no vaccines. And still, with this mechanism, we have failed with the vaccine equity because there was merely just not enough vaccines, and those countries who had the resources, they went ahead and negotiated their contracts and got a lot of vaccines much in advance of other countries. Having said that, I think it's a good start. We need much more work to improve vaccine equity, and we are looking at countries like Malaysia, upper middle income countries, other middle income countries in the region to promote vaccine equity, to engage in these efforts and make their voice heard. So that's very, very important.
And I think that WHO has been quite instrumental in establishing the independent committee or the panel on pandemic preparedness led by Sir Ellen Johnson Sirleaf and Helen Clark. And I think the reports are so clear, right, that we haven't done enough investment in preparedness. But the Global Pandemic Monitoring Board has also come up with a very strong report, and yet we're not seeing that commitment at the moment. Now, some might say, perhaps we need to have a legal instrument that looks at, a pandemic treaty-like mechanism, because the international health regulations is silent on, the issue around compliance and accountability. Now, this is a very, very difficult diplomatic challenge, right? Because you need to navigate the strong countries who may dislike and completely disagree to anything that is a legal treaty, so to speak. So, what do you think? Is something that Malaysia can do, or don't you think that this is very important to have some kind of legal instrument to hold member states accountable and compliant?
Well, I think this is really to government to get to an agreement, and difficult. These are very complicated, complex diplomatic negotiations which have to take place, and it is because it oversteps sovereignty of the different countries. It would be good to find at least a mechanism for accountability, legal instruments. So that's the question to the governments. How would they be monitored? Would they ask the UN to monitor, or their own? Are there other mechanisms how to monitor legally binding agreements? But having said so, the UN and through WHO was instrumental in having two global agreements which were endorsed by all member states. That's the framework for Convention for Tobacco Control, yes, and also the international health regulations, which are binding. So, but this is more ambitious, what you're mentioning. So, yeah, let's see. I certainly hope so, that we have learned from COVID-19 and get more commitment towards promoting joint negotiations and more transparency, be it in the point of entries, the travel restrictions, and also access to vaccines, diagnostics and treatments.
So maybe I turn to you and also to Daud as well, for this question. How important is it to build international partnership on public health, research, other matters around vaccine development, health tourism? How do we move forward on this? And maybe I hear from you and then from Daud.
First and foremost, thank you for having me, and thank you for allowing me to share some of my thoughts on this really, really important topic. I think COVID-19 itself is an unprecedented, probably the biggest global health crisis that we have faced. We have faced multiple health global crises. I mean, SARS, MERS, AMR, so on and so forth, but never at the magnitude of COVID-19. But what I always say, COVID-19 is basically like a stress test upon systems and even networks, not just on countries, but on global cooperation, global response, and even legal framework, and so on and so forth. So the mantra that we always say, even in locally in Malaysia, is like to address this issue, we need a whole of government, whole of nation, whole of Malaysia kind of approach. Sadly to say, sometimes when it comes to a crisis, we tend to isolate and we tend to work in silos, and this is not just in a local national level, but also on international level. It could be psychological in the sense that, let's just let's protect our own people. But the fact of the matter, such pandemic shows that no one is safe until everyone is safe. That's why the three, as you mentioned, are the three holy tripartite of our public health diplomacy, or even science diplomacy and also vaccine diplomacy is so important. Because, for example, at the start of this pandemic itself, one of the reasons why a lot of countries could handle or approach it quick was because China, where the pandemic first started, was willing to share how they approach it, how are some of the interventions, and so on and so forth. So that gives us a head start how to address this. Imagine if they say, you know what, we just keep it to ourselves, and we could be in a very more difficult situation because of that. And science diplomacy is so important. As I said just now, that was mentioned, every of our decisions, interventions has to be based on science. And science is not just an isolated thing, it has to be shared. So of course it's difficult because sometimes people want some IP or some ownership to it. But when it comes to a pandemic, this cannot happen. And I would like to see an even broader database where different countries that has been approaching or learning different things to put in this database where we can extract information, learn from, and even interpret for the greater good. Vaccine diplomacy itself, and I think Dr. Loh has mentioned in terms of vaccine equity, I think this is something that we really need to address. Even exchange of knowledge on how nation states, even like Malaysia, how can we develop vaccines for ourselves? This is not just to cover our population, but this is for future security, especially we're looking at future pandemics, which will be exacerbated by climate change, zoonotic infections, AMR, which is very concerning, and how can we learn from it? I think one of the good things that the Malaysian government took was that relations with China in terms of when we bought their vaccines, there was an agreement to have some knowledge transfer. Where certain pharmaceutical companies in Malaysia get to fill and finish. But I think now with the Prime Minister launching the whole national vaccine roadmap, it is an initial step, maybe early steps, but then I think with the countries that we have bought vaccines from, I do hope that there will be greater knowledge exchange on how to develop these vaccines and also further vaccines, because there's so many tropical diseases and infectious diseases in Malaysia, and moving forward, we need that tripartite of synergic symbiotic relations between public health, science diplomacy, and also vaccine diplomacy. But for that to really happen, we need strong political will from each governments, from each countries. We are not safe until everyone is safe, and of course we need a proper funding system to make sure this happens. I actually like the question you asked about a legal framework for all countries. I've been always playing with this idea. I do hope that COVID-19 can be a catalyst for countries to really take things seriously on a regional level, not just on a national level. So I would like to see even like an Asian CDC being formed on an ASEAN basis, so that they come up with frameworks of emergency cooperations. So one of the weaknesses in our response globally is once it hit, there was a lot of, it's not just a health matter. You need to go through different agencies and ministries, and there's no one emergency protocol. So if an Asian CDC can handle the health, and there is an emergency protocol for all countries which can be established, I think we can handle it much better, especially future search, future pandemics, and so on and so forth.
I think that you're absolutely right that the opportunity is there with this crisis, but emergency protocols are actually available and guidance from WHO. It's just that, how do you apply this across the board? The good news is ASEAN has, agreed to set up the ASEAN Center for Public Health in Emergencies and Emerging Diseases. And I understand Sarawak will also be investing in a center for infectious diseases. So I think these are good initiatives, but my concern is you need that diplomatic link to link it all up. Because the dangerous thing about establishing centers and so forth is when things start going into silos, and diplomacy is exactly to break those silos to ensure people come together. So I think it's great to hear that you are also calling for the same level of engagement at the regional level as well. I think my personal view is that we should have been a bit more self-reliant, right? If we had invested in this, and mind you, this is not the last pandemic we're going to face. Maybe our region could have been better prepared with medication, with testing kits, not just vaccines, but even simple testing kits, digital tools for us to monitor, and then of course ultimately vaccines. I think then ASEAN could, with this very large population, but also emerging economy, can play a very important role globally. So I think that your point is really, really valid there. And turning to you, Daud, we're talking health, but you know what? The tourism industry has been so badly hit by the pandemic. And, you know, diplomacy cuts across health, cuts across tourism as well. So what are your views on that question I posed about the importance of regional partnership, international partnership, you know, in public health, but how do you think the tourism industry can play a role there?
Thank you so much, Tan Sri, and I'm very happy to be here and part of this particular discussion. Well, in regards to medical tourism specifically, this health diplomacy is very crucial. As you see, even if although health is a very focused subject related specifically to the medical fraternity, but when it comes to global issues, we cannot run away. I think Wadi Calvin and Dr. Noor have put it very clearly. The core of the issue is that it is a multi-stakeholder issue that needs to bring people together. I'll give you some example. In relation to medical health specifically, or medical tourism specifically, when the pandemic hits, we wanted to discuss with several of our partner countries in terms of how to continue the flow of patients coming into Malaysia, and we can provide that patient care, continuity of patient care. When we discuss with our counterpart with our neighboring countries, of course, at the level of medical to medical fraternity, we can discuss at length and how to maintain the flow of patients and all that. But at the end of the day, even our counterpart will say that let's escalate this issue to the foreign ministry and let the foreign ministry discuss and iron out the details. So as you can see, we can discuss it at the technical level, but when it comes to global, or I would say bilateral issues or bilateral relations in terms of moving things forward, it has to have the diplomat, I would say cooperation from diplomats to work together and assist us in terms of paving the way and bridge that relationship either bilaterally, regionally, or multilaterally. So this is very, very crucial for us. And I would say even this partnership goes beyond that. For MHTC right now, one of our main function and Malaysia Healthcare Travel Council, one of the main function is to bring people together, especially for ensuring end-to-end patients care when they come to Malaysia. So we managed, at least for at our level, to bring in the private hospital, bring in government agencies, and also civil society together in ensuring that these services is provided to the patient. For example, now we are working very closely with Tourism Malaysia, with Matrade, MIDA, in fact, together with Ministry of Foreign Affairs in terms of how to ensure that when people fly into Malaysia to seek treatment, we can ensure that they will have the minimal disruption in terms of their traveling experience. And then from the private hospital perspective, on the private sector side, they will provide a safe and secure environment for the patient, for the safety of the patient, and also for the safety of our doctors while treating them, and then throughout their care in Malaysia and until we send them back home. So this whole journey of experience within Malaysia can never be done only by the medical fraternity. We need the collaboration of all these players in order to make moving this forward.
So on that note, I'm going to turn back to you, Dr. Calvi. All this costs money. Right. Health diplomacy is really important. Right. But, you know, are we investing enough? I mean, you've been on the Parliament Budget Committee and now you're on the Health Committee. Isn't this something that all parliamentarians should really champion, you know, for increased support to health diplomacy, to the Foreign Ministry and to the other agencies that, you know, are required to do this?
Of course, the general answer is yes. I think there is an increased awareness on the importance of health diplomacy. There's an increased awareness that we need stronger international cooperation, especially when it comes to health. But I think when we look at health budget in Malaysia, we have been chronically underinvesting in health, not just infrastructure, frameworks, but of course diplomatic relations in Malaysia. But then we cannot just look at one budget itself to actually predetermine whether we are bad or not or great. I mean, I can even base it on this the most current budget. We did see a minor increase. For example, in the health budget itself, it's about 1.5% increase, although majority of it is on expenditures rather than DVACs, which is very important, especially when you develop other sectors. Again, I wouldn't say that it is wrong, because we need excess expenditures to deal with, of course, not just COVID, but the backlogs of non-COVID patients and stuff like that. But then, of course, ideally, I would prefer this budget to be a bit more visionary in terms of looking and learning from COVID itself on how we can address it, not just on a health side, but as a whole of government. Like in my select committee, in the health select committee, we released a first report, and one of our recommendations to the government, and the first and fundamental recommendation, is we need to think and have health policies in all policies. So it's not just the responsibility of the Ministry of Health, but it's health in every single policy, health in foreign ministry, health in home ministry, health in all the other ministries. So of course, from this budget alone, I saw that there is an increment even in the foreign ministry, maybe about 90 million. It's not much, but I do hope that it will be invested into addressing this very specific but very important role. But with that said, as I said, we cannot judge it based on a singular budget. I think it has to have, the government need to have a vision for at least the 5 to 10 years, even like, for example, the roadmap to vaccine development. It cannot be, or this year I give money, next year I don't give money, next year I reduce it, next year I increase. So then with inconsistency, because there is no big vision, no bigger vision, no roadmap, no framework, then it wouldn't work as well. So that's my challenge for the ministry and also the government, any government of the day. Let's have long-term plans set forth, not just deal it on an ad hoc yearly basis, but let's have a reform framework of what we want to do, and then plan for it on a longer term.
I'm smiling behind my mask because this is exactly what's needed. Because if I can share, coming from the planetary health perspective, health itself, the determinants of health, only 20% is in the medical care complex. 80% is environmental, behavioral, social, and all this requires all agencies to be responsible. So your health is not determined only by the health ministry. It's also your lifestyle, the food you eat, the genetics, the social economic status, and so forth. So, we're all behind you on this. So, but coming to you, Dr. Loh, how is Malaysia doing really on health diplomacy? Who's our competitor in the region? How do we encourage our government to invest in health diplomacy? What advice would you give?
Well, I wouldn't say competitors. So I would say health has been firmly anchored in many countries as part of their national security plans, and also in their foreign policy agendas. And some countries, so there's a variety how countries have done that. Some countries have used foreign policies to promote global health, and some countries have used it to get more visibility in the arena. So I think Malaysia is positioning itself in health diplomacy as part of foreign policies. We can see these signs, and in particular, just the examples to give that Malaysia has been active in regional bodies like ASEAN, APEC, also in Commonwealth, and also with WHO at global level and regional level. Malaysian Ministry of Health is taking the vice presidency next year in a multilateral body like WHO at the World Health Assembly in May next year, and they are also part of the executive board. So I would say Malaysia is doing more and more in health diplomacy. And maybe just to give an example of other countries, it's not competitors. It is to show how countries engage in global health and foreign policy. Is the example of the U.S. President Emergency Plan for AIDS, PEPFAR. That's an example of the largest international health budget for a single disease, which was because of the national security concerns, and it was brought into foreign policies and has benefited not only the recipient countries but global health overall in the area of HIV. And then let's look at the European countries, the international health regulations. So health was part very prominently in the national security reports featured and with emergencies. So this is why there was a strong push of the European countries to revise the international health regulations in 2005. So So I think Malaysia, as a member of ASEAN, of APEC, also Commonwealth, which maybe plays a less role, but now with the UK efforts, the Commonwealth may be becoming more prominent again in global health issues. Malaysia could play a very, very important role here.
Encik Daud, do you have anything to add to Dr. Loh's comments earlier about health diplomacy in the region and internationally, and how are we investing?
Sure. Thank you, Tansi, for this opportunity. Well, when it comes to the issue of competition or competitors in health diplomacy, we tend to look at it more as a collaborative effort rather than a competition. And I can give some example specifically at the global level or multilateral level. There are some key issues that need to be shared cross-border, and some understanding must be put in place so that we can share this information. For example, when it comes to surveillance system, this is an early detection mechanism which is very, very important. I know WHO is very, very strong in this, but in order to have this very effectively, the sharing of information, sharing of bio information among several key countries are very, very crucial. This needs to be implemented because we know right now data is very valuable, information is very valuable, and this industry is also heavily, I would say, influenced by very strong pharmaceutical companies as well. So they also have some key influence in some of the decisions being made in this arena. So issue of intellectual property rights, for example, is also a key issue that need to be ironed out so that the issue of surveillance or early detection can be addressed very clearly at the global and multilateral level in order to have an early detection to mitigate future occurrence of such pandemic. At the bilateral level, country and also the audience will be a bit more manageable or easier to I would say, to clinch an agreement because the party of negotiation is very limited, and then we can have a better understanding. This we can see happening when we discuss with Singapore on the issue of RGL and VTL in terms of movement of people cross border. So that can be done easily with many partners country, many country partners. But finally, unilaterally, some country has also made some decision and bold move in terms of allowing people to move across border with certain conditions put in place. Like Malaysia, we have certain SOPs put in place to allow patients to move across border and to seek treatment elsewhere beyond the border of their country. So this can be unilaterally done by individual countries, which allow the movement of patients across border as well.
So we focus quite a lot on COVID, rightfully so, on vaccines, but surely there are other threats that are going to confront us, right? Maybe I turn to you, Dr. Loh, as the WHO expert in the region and the representative. What can we expect? What is the future going to look like for health?
Well, we have gone through an exercise at WHO with member states and using strategic health futures dialogue to project what would be the priorities like 40, 50 years down the road. And the consultation process, we determined that, of course, emerging infectious diseases remain high on the agenda also in the future. Antimicrobial resistance is certainly very important. It goes far beyond health, human health, but animal health, agriculture, veterinary services, food industries, and so on. And then the non-communicable diseases, which are very, very prominent also in this part of the world. There are, of course, many, many other issues of concerns, issues which are important, like health-related impact of climate change is very, very prominent also in our framework. But then also we have still communicable diseases and outbreaks, tuberculosis, polio, rabies. They remain important to address, and the underlying conditions which are leading to these gaps, reaching unreached populations, for example. So I think it's important to keep that in mind when our foreign diplomats go out, that they have a good understanding about what's down in the future and whether our systems are fit to support that. And many of these areas, again, cannot be tackled by one nation on its own. Climate change, health-related issues, non-communicable diseases, food industries. So these are all matters which go beyond one country also, and beyond beyond the health sector as it is. So maybe just to set the scene.
Yeah, I think we've just completed COP26, and one of my friends did a little survey and found that many people, even in government, didn't even know what COP was, right? So the awareness on some of these big international discussions, which are so important. And for the first time, the COP had a health pavilion in Glasgow. So health has now been seen as one of the ways to really emphasize the importance of climate change. And we know that, the data is clear. 7 million people die as a result of air pollution. I was on a panel at the COP with a wonderful woman called Rosamond, who you may know. She had a landmark case in the UK where she managed to get her daughter, her young daughter who died from a very severe asthmatic attack, to be changed to the cause of death is now stated as air pollution. Now, she took many years to get this change on the death certificate, but really signaling a very strong call for us to pay attention to the quality of air. Now, air moves. So, we've seen in Malaysia, the issues around the jerebu, right? The haze that we have to go through. And this haze has boundaries, it crosses boundaries. So, from the perspective as a parliamentarian, this must concern you, Dr. Yee. So, what advice would you give, in Parliament? What is the advice you would give to the Health Ministry, or to the Foreign Ministry, or the Agriculture Ministry, or, small, medium, or whatever, all the different industries, that climate change really has serious health risks, and our diplomats need to be present in these climate conferences, from the health side as well.
So as I said at the beginning, I think one of the most fundamental lessons we need to learn from COVID is that we need health in all policies. I think governments, not just Malaysia, but around the world, need to find ways to work as a cohesive, not just silo ministries, but how to work as a cohesive government to address these issues. One of the things about climate change, which is something I'm so passionate about, is people don't really identify it because they feel it does not affect them. But COVID changed the whole thing. I mean, zoonotic diseases probably was exacerbated by climate change, and we know that air pollution causes so much deaths all around the world, and even in Malaysia. So as long as we find ways how to relate big issues like climate change to how it affects the people, then politicians and parliamentarians will take notice. And once they take notice, then governments need to find comprehensive ways to address them. As I said, they cannot again work in silos. They need to find ways to work together and find that it's not just a national issue. You cannot just solve, for example, NCDs by treating them. You need to solve their whole lifestyle. You need to solve food security, availability of healthy food, prices of healthy food. So it is a cross-ministry kind of thing, and I think governments must take lessons.
Yep. You're spot on. I think it's the environmental degradation that is the biggest driving force for zoonotic leaks, and I think our consumption patterns are just crazy. We're going to hit the Black Friday today, and where people buy things they don't even need, right? So, yeah, but I'm going to turn to you, Daud, and challenge you a little bit, right? So health tourism, it means people flying in and out and doing all sorts of, getting health care. That's going to be against, what one might say is, how you decarbonize, right? So what would be your pitch in terms of the diplomacy role of, health tourism vis-a-vis, healthcare, but also, how do you look at minimizing carbon carbon production?
Thank you, Tantri. There's a bridging point that we can see between health diplomacy and health tourism. When we talk about health diplomacy, it's not necessarily that we go out to another country and provide healthcare and try to find people that we can collaborate with, but it's also an area where we can bring in people who can also benefit from the treatment and healthcare that we can provide in Malaysia. To give you an example, Malaysia, we have a unique selling proposition whereby in Malaysia we have world-class quality healthcare services. This is very well documented, and we have been receiving several awards in terms of Destination of the Year and Best Country of the for World Healthcare by respective international journals. So with this high quality healthcare, we also provide an accessibility to international patients to come to Malaysia at affordable cost. Treatment in Malaysia is capped by the Ministry of Health through a certain act saying that any treatment and any medicine cost cannot be beyond the cap that has been set by the Ministry of Health. Hence, the cost of seeking treatment in Malaysia is very affordable. It can be as low as 60 to 80% compared to some other developed countries. So what I'm trying to say is that global community should not miss this opportunity to come to Malaysia and seek this treatment where they can do it at a very affordable, and they can have access to this treatment almost immediately with very minimal queuing time to get access to this treatment. So this is something that we are a strong proponent of. Rather than we go out and try to assist people abroad, we want people to come to Malaysia and take this opportunity that we can offer from within our borders itself. So this is where we need to work together very closely. As Tan Sri was mentioning, how do we balance it in terms of safety and security for people to come? So our campaign going out in 2022 immediately is to ensure that to build confidence and trust for international travelers or international patients to come to Malaysia, indicating that Malaysia is a safe and trusted destination. They can come here because Malaysia has created a path for patients to come to Malaysia even since July 2020, when the whole world is under the lockdown for Malaysia, because we are very mindful of the patients abroad who need immediate treatment in acute cases and continuity of care, especially people with heart conditions for cardiology treatment and cancer patients for oncology. We create a pathway for them even since 2020. We work very closely with Ministry of Health. We work very closely with the National Security Council and also with the Ministry of Foreign Affairs. And we have managed to create the standard operating procedures or protocol in safely to bring in patients since 2020 until today. And I can safely say, Tan Sri and audience, that today, any patient from any country in the world can come to Malaysia and benefit from the treatment that we can offer through our SOP or through our protocol that can ensure that their safety and also the safety of Malaysian citizens right now. So there's a very strong bridge between medical tourism and health diplomacy that we can be a proponent of, especially positioning Malaysia for this particular purpose.
So I'm going to put you on the spot a little bit more. So during the pandemic, we know that tourism was very badly affected. Pre-pandemic, we know MHTC has been going all out, traveling everywhere to sell Malaysia as a health destination. Now, post-pandemic, as we recover, or rather in the recovery phase, and we're in the transition right now, we talk about a recovery that's going to be better for everyone. And I come back to a greener recovery, right, which is less use of fossil fuels, decarbonization, basically air travel, okay? Is the MHTC going to even attempt digitalizing health so that you can actually do tourism without people traveling? I mean, medical consultations without people having to travel.
Right. Very, very pertinent point indeed. This touches very specifically on digitalization. Digitalization in travel and tourism and medical healthcare is always there. It is moving on a gradual basis, but the pandemic has pushed it in the need basis, whereby it accelerated that process very much. Specifically on my end, when we talk about medical travel, there are two things that we are looking at when we come to adopt this digitalization. Number one is that in terms of our engagement with our potential patients abroad, We used to do on-site expo, seminar, and promotional campaign in various destinations. But when pandemic hits, we saw that moving into digitalization, digital marketing and promotion can be very focused, can be very targeted to the right people who are in need of this treatment. And that is value for money in terms of our investment in terms of marketing and promotion. Beyond those marketing and promotion, in terms of specific treatment, our private hospitals, the challenge is now for them to adopt new technologies in terms of providing telehealth. It has been there, it is moving. As I said, the pandemic has pushed it further and accelerated this process. And the private hospitals are very well aware of this. So they are embarking into this. We are working with the Ministry of Finance right now, Tan Sri, in terms of looking at how to encourage in terms of incentive to get this private hospital to move into digitalization and also offer telehealth. During this time, in terms of getting our engagement, I would say continuous engagement with our patients, many of our private hospitals are also embarking on teleconsultation as well. This is still to create that familiarity, to create that personal touch with the patient while they are waiting for their turn to come back to Malaysia. So there is this move towards this direction. But for you are right, tourism when they say during this pandemic is the first one to be affected and the last one to be recovered. But medical tourism specifically, we can treat it very differently because leisure travel we are looking at it's nice to have. Although sometimes after a long lockdown we think that it is a must-have. But for medical specifically, for many cases, it's a need, it's a dire need for people to start to travel and to gain this treatment. Telehealth has its limitation at the moment. Whether we want it or not, we need to bring the patients in and across border and treat them safely and securely. And Malaysia has been able to do this very effectively.
Two questions. The first one is whether there are standards and benchmarks on health diplomacy. So maybe you can take that, Dr. Loh.
That's a difficult question. I'm not sure that there are standards and benchmarks beyond what WHO guidance which exists, agreements like, for example, for emergency preparedness, we have the Asia-Pacific Strategy of Emerging Infectious Diseases, APSET, which is now in its third iteration. And there we are giving benchmarks, what should be in place. We have also, this is to implement international health regulations, an agreement which has been signed by all member states and has been revised in 2005. And that's being monitored. And maybe with COVAX, I could say like they had set targets for vaccine coverage. So these are some of the benchmarks which exist strictly limited to the health arena. But beyond that, in foreign policies, I'm not so sure. Maybe someone else is better placed to answer that. But in terms of health, WHO as a multilateral agency, the organization in the United Nations responsible for health and technical specialized agency, so we are a little bit independent from the United Nations in that sense, but we have established standards and guidance for specific areas. Yeah.
So the second question that was posed was an interesting one, the paradox, right? I think it's a real thing that we're going through. On one hand, the question says that the Ministry of Health is trying to curb the spread of diseases and is much more conservative and locking down and closing borders. But on the other hand, the ordinary citizen wants to get out and get his job done and increase his livelihood. So, and that includes opening up tourism, right? So where does MHTC stand on this? That was the question.
Well, obviously, the primary concern is the safety and security of the Malaysian citizens when it comes to the Ministry of Health. We can understand this through this policy that we implemented. But with the new minister, which is KJ, is very, I would say, practical in terms of how to move forward. He sees that the balance between life and livelihood need to be struck very clearly so that people who are looking for safety and security are also people who are looking to survive in terms of their businesses, in terms of their daily life, in terms of also having leisure with their family outside. So this is where we can see now some of the policy implementation is moving towards getting people a bit more balanced life towards managing this pandemic. We can see that first and foremost, the travel among states have been allowed with strict restriction. Langkawi has been open for domestic traveller initially with strict restriction as well, and now Langkawi has also been open for international travellers, which we are still waiting for the first inaugural flight coming into Langkawi. And we can see also the I would say the successful discussion with Singapore on BTL in bringing in either business travelers, patients, or in fact leisure travelers as well. So this is the movement towards the direction of balancing life and livelihood. But the underlying principle has always been the national security for the national citizen is paramount, and that has to be maintained. It's not just for our national citizen only, it is also to create confidence to the global community that Malaysia is able to manage our COVID situation very, very prudently and very, I would say, effectively, so that in the future, people can start traveling again, the economy can spur either in the tourism sector, medical sector, or other parts of businesses as well. So this is something that is in the works, and we can see that this is how the country's policy is moving into the future.
So, ladies and gentlemen, the audience, I think you agree we've had a really rich discussion, really great inputs from our panel. And, you know, as we come to a close, I'm going to turn to each of them and, you know, to give advice to Wisma Putra, you know, on health diplomacy. What are their views? What should they focus on? You know, and perhaps even, you know, where they might get assistance to be able to promote health diplomacy as part of the framework that Wisma Putra will be coming up on its foreign policy. So let me turn to you, Daud, because, you know, the virtual ones are always left behind, so we don't want to leave anyone behind. So you go first.
Sure. Thank you so much, Tan Sri, and also to YB and Dr. On my part, as the head of Malaysia Healthcare Travel Council, I just like to reiterate that Malaysia is in a very unique position to offer to the global community the healthcare, the high quality healthcare at affordable prices that we can provide. I would say to the global community, it's a missed opportunity for them not to be able to seek treatment in Malaysia. Hence, we have created this pathway to strict protocol for them to travel to Malaysia to seek this treatment. This is very, very important. And to me, this is part of health diplomacy, whereby we can provide these services at high quality, affordable pricing, and immediate care that they are looking at, especially for acute cases and people with immediate treatment that they are required. Number two, for Wisma Putra, I would like to thank to all the diplomats who have been a strong advocate for Malaysia healthcare travel. I believe we have so many officers abroad, missions abroad, and they can become our advocates and amplify the message that the benefit of getting treatments in Malaysia, or for the benefit of people to come to Malaysia and seek their treatment. So I wish to work very closely with all the missions abroad in amplifying this message for the benefit of the global community as well. Thank you very much.
Thank you very much, Daud. I'm going to turn to you now, Dr. Loh.
Well, as we discussed in this panel, these international health challenges have generated really demand for more diplomatic coordination and multilateral responses as health threats impact global economies, security, human rights, and many more things. So public health and foreign policy must be coordinated and addressed together, and I think Malaysia can play a very important role in this.
Thank you. And Dr. Yi?
I think this whole pandemic should serve as a lesson to all of us. And I think one of the biggest lessons we need to learn is that we need multilateral cooperation. We need to work together. Fact of the matter is we are not safe until everyone is safe. On a local level, as a parliamentarian, I would like to see all ministries having their doors open to one another, to not have a ministerial response to the crisis, but a governmental response as a whole. And the key to keep those doors open is diplomacy. So the Ministry of Foreign Affairs plays an important role, not just on a foreign level, but to empower the local level how to have the art of diplomacy to work together to address this issue. And on an international level, the same thing. We cannot stay national, we have to think global. Because threats of the future, as mentioned by Dr. Loh, will be, not to paint a negative picture, but maybe worse. Climate change is an existential crisis that we really need a global concerted effort, and the art to make sure that we work together, respond together, face it together is the art of diplomacy. So the fact is, I like to see, I may be wrong in this observation, but we have really good doctors in Malaysia, we have really good diplomats, but we don't really mix them together. The art of healthcare diplomacy is another set of arts. So I think the Finland Foreign Ministry plays an important role how to empower and merge these two together so we can be a stronger voice on the global arena and push the important topic out there.
That's a great input, and I think allow me to use my moderator role to add on a little bit. I think that I have worked with so many diplomats in my entire lifetime, as you have too, I think, Dr. Loh. But with our Malaysian diplomats, certainly in the last 20 over years that I've been doing humanitarian work, they have been incredibly supportive. Really always mindful of, ensuring that, standards are met and giving advice and so on and so forth. So I think great investment needs to be made in our diplomatic missions, our Ministry of Foreign Affairs, because we have seen with COVID-19 that unless you have those diplomatic negotiations done well, you can't get your vaccine, you can't get your travel opened up, you can't get your economy going. So there's so many ways that the Foreign Ministry and our diplomats play such an important role. One thing we haven't spoken about, and I think I would be remiss not to say it, is the role of civil society. I think NGOs, the Malaysian Red Crescent and others have been exposed to international diplomacy. Certainly in my previous life, all the international humanitarian law, fundamental and principles of humanitarian assistance, they're all part and parcel, the Geneva Conventions and all that. These are all things that diplomats have to also engage with. So I think partnership is the solution. I think there's no one ministry that has the answers, but if we all work together, and we're sitting here in the Institute for Diplomacy and Foreign Relations, I think that IDFR has a tremendous role in maybe creating a module where we can actually strengthen health diplomacy, and certainly I will offer any support that I can to it personally, and I'm sure you too, Dr. Yee and Dr. Loh and Daud as well. So with that, ladies and gentlemen, really, really enjoyable discussion here. Thank you so much to our panelists. Thank you again to IDFR and Wisma Putra, and wishing you all good health, stay safe, get your boosters, and don't forget your public health measures.